Cardiogenic acute pulmonary edema. Let's picture cardiogenic acute pulmonary edema as a city experiencing a sudden, severe downpour. The city's stormwater drainage system represents the heart, efficiently channeling rainwater, or in physiological terms, blood, away from the streets, symbolizing the lungs. The water is then sent back to the river, representing the systemic circulation, which prevents flooding and ensures the smooth running of the city. Now, envision that the drainage system begins to falter, possibly due to structural issues or a lack of maintenance. With this decrease in efficiency, the system struggles to cope when a torrential downpour hits, representing increased preload, coupled with the river swelling beyond its capacity, mirroring increased vascular resistance. Consequently, water backs up and begins to flood the streets, or in medical terms, the lungs. This flooding is an analogy for cardiogenic acute pulmonary edema. In this condition, fluid accumulates in the alveoli due to increased pressure in the pulmonary capillaries, usually arising from left-sided heart failure. The severity of this flooding, or pulmonary edema, can vary depending on the extent of dysfunction in the drainage system and the volume of rainwater. In some cases, the flooding may be mild and confined to certain areas, akin to interstitial edema. In more severe instances, water can inundate the entire city, making it difficult for people, symbolizing oxygen molecules, to move about. This translates to alveolar edema within the lungs, leading to decreased gas exchange and causing respiratory distress. As healthcare professionals, we are like the city's engineers, tasked with rapidly assessing the extent of the flooding, identifying why the drainage system is malfunctioning, and devising strategies to mitigate the damage. Our approaches may involve lessening the volume of rainwater, paralleling preload reduction, or improving the efficiency of the drainage system, analogous to inotropic support, depending on the root cause of the heart failure. By understanding the pathophysiology of cardiogenic acute pulmonary edema, we can act as effective engineers, developing targeted interventions to alleviate the flooding, restore efficient circulation, and ensure that the city, or the patient, can breathe easily again.